Yep. All right. So went live.
We are live.
Yep. And you're live too.
Mm-hmm.
All right.
Mm-hmm. Wait, where the heck is? There we go.
Okay, totally live now.
Excellent. Looks like Kimmy's in. Or she just Kimmy just shared our link. So
Live on Twitch, live on Substack. Chat is open. Live on Twitch.
just waiting. Is hey Kimmy?
Yeah, Nick is over. Nick is over on my end of the stream. What's up, Nick?
Okay. Nice. So if we're all ready, we can get started. My name is Sushi. I am the host of Mindhaven. We are a weekly roundtable group that we like to just discuss different topics surrounding mental health. Along with me, I have co-host Tig, and we're very happy to welcome Naida Green. Naida, I'm trying to get it right, Naida, okay, to the table to talk about civic engagement and the peer-run mental health movement. So this will be a great conversation. With that, we'll let Tig go ahead with our disclaimer and we'll get going.
Hello, everyone. Welcome to Mindhaven. We are a safe space for discussing mental health topics and conditions and lived experience by non-professionals. If you are in crisis, please do not DM any hosts or participants. Instead, you can call or text 988, as you can see in the ticker below. If you are a service member, please reach out to 83255 for the LGBTQ community. You can refer to the following all along the ticker. For that being said, let's get started, shall we?
Let's do it.
Oh,
So, yeah, go ahead, Naida.
I'll just introduce myself. Just
Sure.
think it's easier that way. So hi everyone. I'm Naida Green. I am the CEO and founder of Disability Community for Democracy, and also the publisher of Disability Community for Democracy's publication called Nothing About Us Without Us. And I am gonna wish everyone. Last month was Mental Health Awareness Month. This month is Pride Month. Next month is Disability Pride Month. And I thought it was important for me to get back to my roots and talk about how I started in disability. Now, I think a lot of people who have heard me before know my story around I've been disabled my whole life, and special education and college and stuff like that. But my first taste of disability activism as an adult outside of self advocacy, and I'm not saying self advocacy isn't important, but the key word in there is self. Versus system advocacy was when I was struggling with my mental health in the early 2000s, and I ended up in just my mom worked for Department of Social Services at the time, and she was like, "You need to like handle your business and get it together." Because my mom was no, I think it's different though, Tig, because my mom wasn't trying to shove me into a hospital or put me on medication unnecessarily. I'm hearing feedback.
Oh yeah,
Yeah.
no, yeah, fix it. Don't worry about it. Got it. Keep going.
I think that's so. I ended up taking, long story short, I ended up taking a peer advocacy course and doing an internship through the agency no longer exists. Was Westchester Consumer Empowerment Center. It became they did business DBA as the Empowerment Center, and they went from really being like a um, storefront. I mean, they did rely on government funding, but they were more engaged in civic engagement. And by the time I left, they were starting to transition to more corporate, but they didn't want to pay people. So, and it wasn't good for my mental health. So I was like, I'm out. Um, and I was doing a lot of activism in LGBTQ spaces. At that point, it wasn't even LGBTQ, it was like LGBT.
Yeah.
And this was the 2000s. So that's how that's where I started my advocacy as an adult. And then as I got older, I just, switched over to general disability.
Mm-hmm.
and the civic engagement was great in the beginning. It was more diverse. And now it seems like everyone in peer support who's doing it now is mainly white. And I mean, New York, it's gotten so bad that in terms of like how corporatized it is, it's New York State actually offers training for it.
Mm-hmm.
And Tig probably knows about this because Tig, you live in New York.
Yes, I am unfortunately well acquainted with the whole thing as far as New York mental health services are concerned, for better or for worse. Ugh. Oh my god. To say the one thing is that New York State has well, as far as from the rest of the country, New York State has got their shit together and then some as far as services. But in terms of the rollout and the execution and the practices that go behind it, that could be hit or miss depending on what your needs are. And I think this is something that I really was looking forward to talking with you more about, Naida, in terms of civic engagement and like peer run mental health, simply because there is mental health awareness is always important, and we want to make sure that we have this awareness, but there is a large undercut, and there is a bit of a lot of dissonance in how mental health is treated, that hasn't truly been addressed from its borderline puritanical roots of where they started. And that really goes into I mean, I don't want to, this is something you may feel familiar with, especially in terms of social services, but from your mother's experience in social services, is that I mean, growing up, I'm 26 now, growing up to the 2010s, and this whole, autism is a new thing, but this movement towards like mental health being something you have to be aggressively treated, this idea of that mental health was something you have to be aggressively treated in the same way you would a chronic illness or something lethal like cancer. It was a very much like, oh, it's an illness, you won't blame someone for having an illness. The problem is, for a lot of mental health issues, conditions, bipolar, or even like complex PTSD, like I have, this aggressive, like, oh, we can treat it. If you just take this medication, you can fix it. You can live a healthy life. You could be able to do all these things that you want to do and won't let you stop you. It was very much aggressively toxically positive, and aggressively toxically positive to the point where in my case, it actually caused a lot more harm than it did any good. Because crazy, yeah.
Well, I also think, and I'm going to say this as somebody who felt a little bit the same way as you did, in certain situations, but also understanding that you're 26, I'm much older than you, and I also think like we are going to disagree because there's just going to be a generational divide there, because they weren't treating mental health at all as an illness. And also, Tig, you have to also like remember, people were getting pushed into the subway in New York City because of lack of treatment. So like,
Yeah.
just because you had a bad experience in the system, and part of it is, and I'm going to say this as somebody who's had some bad experiences themselves, it's also about these are people.
Exactly.
And let me finish. These are people. And sometimes if you talk to a person in a way that they don't like, they're just going to react like anybody else. And, to expect them not to, that's one thing. And then also too, autism wasn't a new thing in the 2010s. I mean, they were talking about autism in the 2000s,
Yeah.
not to 2010s, but again, also, they were, like I remember when they were saying, vaccines caused autism. They were saying that in the late 90s and 2000s. So I don't think we need to act like they were acting like autism was brand new, because it wasn't.
Yeah, it wasn't. It wasn't new at all. But I think like the way of the perception of it that came into it, it's like, oh, it's not a death sentence. It's not this lethal, horrible thing. Instead, it is this thing that you can be managed. It can be treated. But it's a shift from like, okay, it's this horrible, shameful thing to, oh, this is still bad. But in spite of that, we can be inspiring and we can still move forward and just be fully for it. It was the way it was treated. It was still like a step up from being death sentence institutionalization, but it still was incredibly damaging in a different form. And that kind of goes into like especially how even like as of like the last 5 years or so, neurodivergence, the criteria has been expanded tenfold, and it has been expanded. There has been a lot more research and understanding for it in the last like 5 years or less. And unfortunately, that's due to cases like mine, and allows others.
I don't think it's only due to cases like yours, because I'm going to say this, it comes across as like you're the only one who's been through it. And I also think you got to also take into consideration that, one, you live in Westchester. You grew up in Westchester. You grew up in Northern Westchester with parents who had access to resources, and they leveraged those resources like how white people leverage those resources. That's the difference, right? Like, I'm sorry. I mean, they had more resources than even my mom did. The only difference is that my mom worked in the system and she knew how harmful the system could be. So she made sure that I was protected. And my mom was born in the United States. And I do think there is some immigrant aspects in your story, Tig, that's different from mine, even though we're both Latinos.
Yeah, exactly. There is like, even though like my mother was also working in the system, she was a special needs teacher for 20 years, the whole 9 yards. The problem is that there is a level of, on one hand, you can be working within it, and the other hand, like your mother was able to protect you from the harmful of it. Mine didn't.
Yeah, but
And
is your mother an immigrant?
yes, she was.
That's the difference.
Yeah, exactly.
That's the difference.
She was able to drank the Kool-Aid really quickly, and that was her entire career, and she believed what she was taught. And the harm that came from it was not to be underestimated, of course. And of course, I never say that I'm the only person that goes through anything. That's never a claim that I made at all. It was more so that there are a lot of cases that, not just for mine, but a lot of other cases that I've seen for kids that grew up in this way, but also this move towards civic engagement, towards like, now that I'm an adult, I'm 26, and trying to like, we recognize that it wasn't all sunshine and rainbows, but it also, there was a lot of harm done. But that harm done is not a throw out the baby with the bathwater sort of thing. There are practices that must be shifted. There are practices that must be changed. And those practices must be separated from the ideas that, even if they were benevolent or not, even if they had good intentions, the practices that came from them or were utilized for so long were inherently harmful, even if that wasn't the intention behind it. And I think that's an important thing for civic engagement to recognize, being able to separate the ideas like, oh, we had no intention of causing harm, but it did cause harm. And that's something, not something that can be denied. It's something that has to be addressed, and that's something that has to be addressed and fixed to move forward.
Yeah, but I also will say there's also wisdom that comes with age. And I say this as somebody who feels some of the same way about the system that you do, but also it's like, look, the mental health system and I'm going to say this as somebody who has been disabled their whole lives, and like, and in special education, and my grandparents also on my father's side, my grandmother was a teacher too, and she, I mean, she used to tell my mother there's something wrong with me all the time, like, like you need to do something, like to the point of like basically institutionalize me. And my mom's like, no. And my mom's been more of like showing, like just try to treat me as much as like as humanly possible with the resources that she has, that like as a human being. And I think also too, when you're a child of an immigrant versus somebody who was born in the United States, my mother was also in the foster care system, so that also changed her experience on how she raised me and the system and how she views the system. That's also important. And I also think, Tig, like there are a lot of people who've also had your experience and also they've didn't harm them. I think it's not just the system itself, it's who your treatment team is. I also think though too, yes, the system sucks, but part of the issue is really there's this divide between disability, the general
Yes.
disability community, and mental health. And yes, New York State has it together in a lot of ways, but as somebody who used to live in New York and now lives in Massachusetts, I would live in Massachusetts hands down 100% every day of the week, because it's one of the best 5 states for people with disabilities in the country. New York State is not even. I think New York State's in the top 10, but not in the top 5.
Not even up there, honestly. Not even top 5, to be honest. Simply because a lot of these practices are still up and running. It's still very touch and go. And even if there was a lot of projects and nonprofits that were launched, like even within my lifetime, that failed miserably because of the harm that they caused. But even then, it's there is a separation between the practice that comes into it and the intention behind it. And even if the intention is like we want to make things better, some of the nuances that go into it, like this, there is a thing with the treatment team. But even so, I mean, not just with the treatment team within it, like my experience that there was like I was put into special education growing up mainly because of the medications that I was put on by a psychiatrist who should not be allowed to practice anymore.
Were you mainstream though? Or were
I did do better in mainstream, actually.
Were you mainstream special ed mostly, or were you separated? Because I was mainstream special ed, not separated.
I was back and forth actually with it.
Yeah,
so
and
I was put into like gen ed. I was put into gen ed, did well with that, and then immediately shoved back into both mainstream and separated special ed with it. That was the program they had at the time. Probably because my mom was a special education specialist in that regard. She was with the school district, and her need was to just have me separated because that's what either she was taught or that's what she assumed was in my best interest, even if it wasn't. I did better in gen ed's classes than I did with people who were quote unquote in my rank, and it was it was interesting because I would not have had to be in the situation cognitively at all if it weren't for the ludicrous amount of psychotropic medications that I was put on at the time. And I think there was especially because you were brought up the treatment team at the time, there was a misdiagnosis on my front by the psychiatrist my parents were forcing me to see for all that time because I was a minor, was bipolar disorder. And you can't diagnose a minor with bipolar disorder. 2, my autism was established when I was 17, late diagnosed, but even then completely was disregarded entirely. And 3, the post-traumatic stress disorder or the PTSD that came from numerous hospitalizations, about 14 in total from the age of 12 to 19, it was back to back. And keep in mind, as nice as like Westchester mental health, their psych wards are no joke. And even to this day, it's still horrific. Because
I'm gonna push back a little bit because I actually worked in the state hospitals.
Yeah,
I'm like, no, they're not like horrific in the sense as what you had a bad experience, and I'm not discarding the fact that you had a bad experience, But as somebody who remembered what mental health was like in the 90s and even in the early 2000s, I wish people would also look like, and I say this about people who are LGBTQ who were around your age, Tig, or even younger millennials, like, you need to learn your actual history about how bad it used to be in New York State. You need to
Yeah,
actually, you
I'm aware, and
aware,
the fact that I watched
aware.
my friend hang herself in her dorm room in the psych ward was pretty enough.
Yeah, aware and aware. I get it. You saw your friend hang herself.
It was
I'm
not the first
saying
time either,
I'm
and
not. Yeah,
it
and
was. I think that's something that like I get the history, and but like the
to
history is there,
you,
and yeah,
you
and
can't dis. You're disregarding history,
I'm
and
not
you're
disregarding anything. I'm really just here, just trying to have a civic conviction as to what we can need to do to move forward.
well. The thing is, you can't move forward without actually understanding the history of the movement,
Yeah,
and you
and you
and I don't think you really like understand how. I'm not saying you didn't have a bad experience, but
and I and you're oh wow.
can I finish? I like I like I'm gonna finish my statement. I'm not saying you haven't had a bad experience.
And I acknowledge that, but still the statement that that you are assuming that I am uneducated on this history when you and I have worked together on this. Wow. Okay.
We haven't worked together on this though. This is the first time we've really talked about this. We've never like worked together on this specific topic before.
I understand, of course, but can we? I know there's a generational side, and we can agree on that there is a generational divide as to what is being learned or not. But it's still, can we not assume that I have not looked into the history and continue to learn more each day? Can we not just assume that one person
Well,
knows any
well,
less than the other, or can we
I'm
just talk
actually
with each other that way?
I'm actually gonna make like I'm making assumptions based on the fact that you're letting your personal experience cloud your judgment when we're having this
Wow.
discussion
Okay.
from my point of view.
That is wow.
I've been two PC'd. I've been one PC'd before. I've
Can we not make assumptions at all? I would appreciate if we just not made assumptions at all, because I don't like making assumptions about what other people know, because I have no evidence as to what other people know. Can we just not make assumptions at all? That would be great.
okay. Tig, I understand that this is a touchy subject for you. And
I don't really appreciate that kind
okay.
of okay, no.
Okay, I'm gonna say this. And I have been a guest on a lot of people's shows. And I also have been I host my own. And
Yes.
let me finish, Tig. Let me finish. I'm a guest on your show. And it's not the other way around. And what I was told is that the discussion was going to be led by me, and I feel like you're being argumentative right now, and I'm not going to sit here on a Sunday night and debate with you about things that like I'm not saying you haven't had a bad experience, but I really don't think I'm saying from my experience, from what I'm hearing, and I have a right to have my feelings about this, like you
No
have
doubt about that.
about this. And that's where I'm having the issue. Every single time somebody disagrees with you, you want to shut them down. And
That is not true.
well, I'm feeling that way right now.
And I
So,
understand how you feel that way. And that is not true.
well, it is true because you want to try to control the conversation, and I'm not going to do that. Sushi, I'm willing to have a conversation with you if you want to have a conversation, but I'm not going to go back and forth. I've been hospitalized. I've seen
No
people.
one's questioning that.
Yeah,
All
and
right,
I've
Tig,
Tig,
let's just move on, and we'll keep on topic. This is going to be, we're talking about like it's kind of like what Mind Haven's all about. Like we want to bring awareness. We're a peer group anyway, and there is a mental health movement, I think, in that direction, and I think it's a wonderful thing. So we all have our own issues, right? The reason why I started this was because I was late in life bipolar diagnosed. And that was just last December. It hasn't even been a year. So I started this podcast to help build community so we can have open-end conversations about mental health. So in regards to that, what's your work in the civic engagement of the mental health movement?
So what I'm trying to do with Disability Community for Democracy now is really highlight that mental health disorders are disabilities.
Uh-huh.
And because a lot of people who have mental health diagnosis don't consider themselves disabled.
Right.
And I'm also trying to highlight in the disability movement that involuntary commitment, institutionalization still happens, and it's still dangerous for some of us that have certain types of diagnosis outside of, because there's a lot of, people talk about the Medicaid and the Medicare cuts, the big thievery bill, for example, and they talk about, losing home care, losing case management services. And these are people who don't they might have a mental health diagnosis, but they're primarily relying on home health care, home health aides, or personal care attendants or personal care assistants, whatever term you want to use. And so they can't get out of bed for themselves, they can't dress themselves. And what people don't seem to understand is when these cuts to Medicaid happen, they also go after peer support services in the mental health movement. Now, I will say this, prior to peer support becoming corporatized, you primarily had like government contracts that gave you grants to do these things. You couldn't bill insurance, and now you're able to bill Medicaid for some of this stuff in ways that you couldn't before. And it has affected the impact on civic engagement. I mean, I remember my agency when they expanded involuntary commitment to outpatient psych, we protested. A lot of agencies don't do that anymore because they're so afraid to lose their funding.
Right.
Does that make sense? Like what I'm saying, like what I'm trying to do is move from like the peer support, mental health, like corporatization, to get back to the civic engagement, because not everybody is going to be able to take psych meds. I can't take psych meds. I take psych meds. I end up, with all sorts of physical things like bleeding and psychosis and all of that. And it's not even that I've been misdiagnosed. I just can't take it. It doesn't do well for my body. So I think that's one thing. And I also do think, and this is something I was taught in the peer support movement, is that about personal responsibility, right? Like, and that was, and I was taught that by the old school people who got shock treatment, and they were like, yeah, fucking sucked. Like people died that I knew, or, whatever, but they were like, it's all about personal responsibility and handling your business. So it's like, it's not about being victim, but it's about like taking what has happened to you and doing something, making a change. And I do think if the peer support movement didn't get corporatized and taken over by New York State, they wouldn't have been able to get away with expanding what like care court in California, or expanding what involuntary commitment in New York State. That's the issue.
Right.
Yes, that is the issue. Peer, I mean, it really just expands. There needs to be a higher caliber in terms of training as to who is able to sign off on a voluntary commitment and who cannot. They just allowed licensed mental health counselors, licensed mental health counselor, or LMs, but licensed mental health counselors essentially is just a master's in psychology. That's pretty much all it is. I mean, a year ago, like before the New York State decision, legislation went in place, the expansion on that front, the only thing you were able to like really be qualified as a licensed mental health counselor is a high school guidance counselor at most. And now they gave them, and now they expanded the criteria for who can make an involuntary commitment decision to include licensed mental health counselors as well, and that can be incredibly dangerous.
Well, and but it could also be not dangerous for people to be involuntarily committed, because as somebody who remembers, who knows somebody who became disabled due to a subway assault, and there's not enough doctors, like we never talk about, like in peer support, like actually working for the agencies, at least back in the day, we used to talk about it in a more balanced way. Like, yeah, there are some people who actually need to be in the hospital and who actually need meds. But now it's like, oh, and yeah, it sucks that some people get harmed by that. But the overall aspect, at least from my experience, and one, using the services, and two, working for the agency, is how do you move forward, right? It's not about how to move, how to move backwards. And also, at the end of the day, like, the person who has a master's in psychology actually has more experience than a lot of the people who are in peer support anyway. Like, they have the professional training, and I trust them more to make that decision than I would a police officer who actually is, like, usually if you come in with the police, you're usually being 1PC'd automatically.
Yeah, they definitely are not trained very well. I mean, there was an incident recently, I believe it was in Texas, and there was a kid, an autistic boy, teen, in the backyard, and he was having a meltdown. And there was a father and son doing some work, like, in the neighborhood, and they heard it, and they called 911, and the cops came, and they shot and killed the autistic boy because he was having a moment. So I think there needs to be a lot more education in the police force.
There also needs to be a diversification as to who is there on these calls. Because if it's just cops, someone is going to get hurt, obviously.
Yeah.
But if it's there also needs to be a third option, besides just handling your stuff and institutionalization. There needs to be a third. There needs to be a third way. Even if it's temporary, there needs to be a third way, because institutionalization is necessary in some cases, but it's not a broad stroke. And that's when you get a lot of people getting harmed unnecessarily. So, and even so, if it's not just handle your own stuff, there needs to be an additional level of support. There needs to be a third option. There needs to be a fourth pathway. And that's something I've been really big advocate for, because that's something that we need to construct from the drawing board, essentially.
And what would that look like to you, Tig? The third and fourth, like a different way to find help.
A different way to find help? I have no idea.
Well, and that's the problem. If you don't
exactly,
know,
I don't know.
Exactly. If you it's, to me, like, this is where I'm like, look, like unless you have a proposal on how to, like, make it better, like a true, like, proposal, you can't say there needs to be a third way and a fourth way. Because I remember, does the crisis team still exist?
Not anymore. No.
Okay, it's gone. It's
gone. It's basically, it went through a couple of renditions. Basically they started making miniature crisis teams on campuses. They called them care teams, and that's in the legal framework right now, because basically they use the care team in place of actual, like, bullying measures or harassment measures against staff and students. That is a case that's currently being litigated in a couple different places, because the care team was kind of being used to skirt around rights and responsibilities in disciplinary cases that would have protected students from false accusations. But even then, it's like it's a very touch and go, because on one hand, it's like, oh, the crisis team doesn't work, we'll scrap it and start with the care team, but that doesn't work either. So instead of finding components that work from each, learning from the past and combining something new together. It's very much like, oh, if it doesn't work, then it's handle your business. But if it's handle your business work, institutionalization. There needs to be a third and fourth option that
Well,
combines the best components of each
well,
of them.
well, if the I mean, I remember when the crisis team wasn't was around, and this is the thing. Everybody keeps talking about crisis team, crisis team, crisis team. There were plenty of times that the crisis team would go without law enforcement and try to talk to people, and they still needed to call the police. So again, like, I say this for people like you take who have had very negative experiences from childhood with the mental health system. I was also seeing school social workers and stuff like that. Also, they did not have the drugs that they had when I was a kid. They didn't have the same drugs that they do now, like in the
Yeah.
So I do think that also saved me, but I also do think that if people who've had your experience, it clouds your judgment. I mean, it's kind of sort of like if I'm an intimate partner survivor, right? Like in a sexual assault survivor. So every single time I hear anything that isn't a third or fourth way, it's like, nope, it's wrong. Nope, it's wrong. And it's like,
That's not how I like to operate at all.
yeah, but I'm saying for me, that's what it sounds like to me. It's like I'm not for institutionalization. I'm for community care. But community care doesn't always work.
It doesn't.
And so if community care isn't working and we don't have people in institutions, we don't have a way to institutionalize people when they need it, and we don't have enough psychiatrists, like we got to live in the reality of where we're at, and
exactly.
But you're saying, well, it's dangerous. It's like, well, do you know that people are not doing psychiatry because there's not?
Of course, yeah.
So
it's not. I think that's honestly why I think I get into conflict with a lot of people my age about this, because it's not so black and white. It's not that it's bad. Never said that. I never said, and that's honestly why I try not to make assumptions, and I really pitch that forward, because when I say I don't know something, it really just goes into play. It's like, well, how can we figure it out? Let's figure it out together. And I think that's something that hasn't been thought of before, because you're right. If there's community peer support doesn't always work. While institutionalization is not a one size fits all, sometimes it's needed, and sometimes it's really, really harmful. It's a very hard handed approach, but there needs to be like a third and fourth option. And I think that understanding, not just in terms of like, well, covering the bases again. So people need housing, right? People need their Maslow's hierarchy taken care of. That's always a given. But in terms of like, we also have to, you're right about dealing with the reality that we are right now, which is a declining empire, a crazy economy, and people are losing their goddamn minds. Mm-hmm. And I think that's something that you're right, that we need to acknowledge the reality that we live in right now, because this is a crazy time, and there's going to be a lot of influx of people reacting accordingly, like human beings, to the situation the reality that we're currently living in right now.
Well, I'm gonna say this, right? Like, it maybe it's because I come from a different frame of mind on this. It's like no excuses ever. Like no excuses. Like to me, it's like, well, there needs to be a third and fourth way, but who's gonna pay for that? Like,
exactly.
Like everybody's saying, well, we need to do this, we need to do that, but who's gonna pay for that?
What does the logistics look like? What does the practice look like? These are things we need to be able to figure out.
But if you can do all the planning in the world, right? And I come from a business background. As I come from the business world, as I've worked in, peer on the peer side, and now I'm in the corporate world, right? I'm a tax professional, and at the end of the day, it's all about, well, how are you going to pay for it? What's the return on investment? And if you don't have the answers to that, you have to have the answers to that with these third and fourth ways. And this is not about, at least in my experience, this is not about an age thing, because I've talked to people who are around your age about this too.
Exactly.
Right, that not like who are in your age group and who understand, yeah, who is going to pay for it, because
Yeah.
yeah,
It doesn't just happen out of thin air. There needs to be logistics with it, and that's honestly why I was looking forward to this conversation, because it opens up the conversation so we could actually figure it out. This is not
I
something that
don't
we can really figure out in one night either. It's not something that
I
just snap
don't
your
I
fingers and
don't
figure it out.
I don't think this is what this I don't think this is my I don't feel like it's my job to figure it out.
Yeah.
It's actually the job of, because again, I'm more I'm more into trying to integrate both movements into one, not separating them like they are, because that's where the harm is coming from. That's what the harm is that we have separated these movements. And my mentor has said, if we're separated by diagnosis, types of disabilities, we're never going to get anywhere. And so if I'm not, we need to, I'm not going to say burn it all down or tear it all down, because I'm not for that. But I am more for, like, we all need to get in a room and see what our like-minded issues are and figure it out from there. Not
Agreed.
like New York State has too many agencies. They have
Way too many.
mental health. They have developmental, intellectual. Yeah, they have
Yeah,
too
but
many.
even then that has an IQ limit. There is additional agencies for different levels of support needs now. There's so like it's in the triple digits at this point.
Yeah, and a lot of states, it's too fragmented.
Way too fragmented. No
So,
communication within them. And they don't talk to each other either.
well, they're not okay, but they're not set up to talk to each other.
Exactly.
Okay, Tig, it's not exactly it. They're not set up to talk to each other because the parents of these people with disabilities want these agencies to be this way. They want the specialization on their child. You can't always blame the state. They react to the community. And so we need to, as all disabled folks, regardless of mental health or whatever, we need to understand, we need to be more in the peer support mode and accountability mode, and the no excuse mode. And what that means to me is, like, we're all interdependent, and we need to do some sort of mutual aid and take care of each other, instead of saying, well, it's the system's fault. I've been harmed, and I'm going to,
Exactly.
blame the system for the rest of my life, because
that doesn't solve anything.
Well, one, it doesn't solve anything, but two, I'm sorry, like, I don't think that people understand how hard it is to, like, I say this all the time for everyone who just does media and stuff. I do more than just this, right? I do more than just write. I'm going to DC this week, upcoming week, to lobby on issues, issues around equity in our country that intersect the disability community. And I will say this till the cows come home. Anybody who thinks it's easy to, I say this all the time. It's very easy to complain about how political candidates suck, or how the system sucks, or I have these ideas, but unless you're willing to invest your time, your money, outside of being on, in media spaces, and you're willing to advocate in government, and sit down and put put your body on the line, like the people who I used to work for. It's talking is not enough anymore.
Yeah, it's not enough to talk about it. We need to like actually have back of house solutions to these things, and that requires roundtable, not just conversation in terms of planning, but also in terms of initiative. I get into a lot of conflicts with people my age about this all the time. Actually, it's like, this is a great idea, and your concern is valid. How do we go ahead and fix it? And honestly, that's why I'm not afraid to say, like, I have no idea how to go about this, because it's means of like, okay, if I have no idea, then that opens the question so we can figure it out together. And I think that's something a lot of people my age struggle with. Honestly, it's like, it's okay not to know, as long as you just go ahead and try to figure it out anyway. You make a commitment to figuring it out.
But I was your age when I was in the movement. I was your age when I entered. I was actually a little bit younger than you when I entered peer support, and I already had like, this is what needs to be done. This is how it should, this is my idea how it needs to be done, and I do think there is, I don't like saying that your generation doesn't want to do. I don't like saying that.
But you're not entirely wrong. It's just I'm kind of the weird one on that front because
I don't like saying that, because it disregards the lived experience that I don't have. But I also want to be clear that it's not just for me about this, I'm a big believer of like, people have a right to trust their gut, or base it on their lived experience, how people are reacting, right? Like, we're all human. And I do think what ends up getting lost in translation and the work we're doing on the media front, especially like shows like this, where there isn't this thing that exists, right?
It doesn't exist yet.
But neither did historically Black colleges. Neither did women colleges. Neither did disability orgs. They did the work, and to be honestly, like, I don't bring, like, I've experienced homophobia. Like, I'm going to use homophobia for example, because I think it's like, because it is Pride Month. But I didn't say, well, I had this, and it's affected, I've had this impact, and it sucked, and I literally had to learn the history first, without taking my personal experience out of it, just reading it down the line, and this is how it was, and ignoring like, and not letting my personal experience cloud what I learned, because that happens, right?
Yeah,
like, you can know. Go ahead.
No, we do have a question in the chat from Courtney. Courtney asked, what guidance would Naida give to the younger generation who want to take action in this area, like specific resources to connect with or look into?
So, I mean, I guess, like, there are plenty of books. Like, just, you could type peer support and mental health peer support movement, and there are plenty of books. If you type, Alex Green just wrote a book on there's I forget the name of the book, but he did the biography of institutionalization in Commonwealth of Massachusetts, to the person who led it, who like kind of was the father of all of that. So I do think it's mainly needing to look up what you want. And I also think this is not about age, because there's plenty of older people who struggle with this as well. Like, Sushi, you got late diagnosed bipolar. I mean, I don't want to just focus on age.
Right.
I mean, I don't want to focus on age. I want to focus on lack of information.
Sure.
And also, I want to focus on not only lack of information, but how you receive information, how it colors your biases.
Sure.
And that's
Exactly.
why Tig and I were having this disagreement, because I'm like, I've been there. And I was younger than you when I went through my experience, and I was like, okay, I can't. Nobody's gonna listen to me if I let like my trauma color the work. Like,
Mhm.
and I learned that the hard way.
Mhm.
And
It doesn't work, of course.
it doesn't work. And
Yeah, and I think that's something that needs to be addressed. And I think being able to separate that is very important. But I also think it's important to like I think also like in terms of experience and not letting that cloud our judgment of who we're speaking to and begin with, because I think being able to like not just bridge that gap, it's not anyone's job to reach or to dumb things down or make someone else feel comfortable, but I think being able to have that bridge, being able to rephrase and retranslate things. So I think that's something that I find a lot. It's like one person says empanada, the other person says pastelillo, even though it's the same exact dish. I think that's honestly something I find happens a lot more because we're on the same page. I agree with you that there needs to be we need to go back to the drawing board, and I agree with you that if you don't have a solution right away, it's not something to bring up. But still, it's always important to be able to open that conversation and figure that out. Exactly, we're on the same page. We're just that conflict is really just saying the same thing in two completely different ways.
I don't know. I'm more of like, I think you're saying, like, we need to talk about it, what I'm hearing, right? And this is what I'm hearing.
Yeah.
Can I just say what I'm hearing? What I'm hearing is we need to talk about it and have the conversation, right? And if we don't have a solution, be quiet. That's what I'm hearing from how you're interpreting it. What I'm saying is not only do we have a solution, if we don't have a solution, be quiet. Why don't people get together? Like, why can't we understand that these movements, we need to get out of our silos?
Exactly.
That's what I'm saying.
I'm saying the same thing. I never said anything about be quiet, and I never said anything about that. I don't like silencing people at all. I don't like assuming what other person knows. I just say, and the best thing, I say what I need to say in the way that I can best express it. And I think that's like that conflict is like you're hearing the pastelillo empanada. We're saying we're on the same page,
I'm not,
but it's just different phrasing.
Nope, that's not that. Nope. I don't. We're not saying this the same thing in a different way. I'm hearing because I'm hearing what I'm hearing from my standpoint of the civic engagement and like what I used to do back in the day to get people involved. People would tell their stories, but it wasn't the end all be all. And they told their stories. They didn't mention that they saw somebody, somebody who they knew, like, and when you mentioned, your friend hung herself in the hospital, like they talked about their story. And I do think if we're going to do this, like, at least from my perspective, the right way, we need to tell our story in terms of like what happened to us. Like, because if we say, well, I saw my friend, like, I'm like, okay. And I mean,
I admit that was a bit of a dump, and I admit that.
Yeah, and it's still trauma. I mean, you know,
of course, but it's also important not to like assume what another person is intending, but without actually hearing them out.
Yeah.
I try not to make assumptions at all. That's why it's like I go into like when I meet someone, I have no idea what to expect. I make no assumptions. I make no preconceived notions. I just hear I just hear what they have to say, and then I will go into the evidence and have a conversation with them on that front. I try not to make assumptions at all for that matter, because the moment you go in with an assumption, that immediately brings conflict, because most of the time assumptions are wrong regardless of who is making it, because it's missing data.
I don't necessarily agree with that. Sometimes assumptions actually are about safety, and actually when you don't trust your gut. And I think also we also again like also I was, taught to, that's what I was taught. I was taught never make any assumptions, but that also would tell me, well, don't make assumptions about anything. And, but if I'm seeing behavior's information.
Of course, yeah, and even then, that like the don't make assumptions about it. That's like you're right about the defense. Honestly, that comes into it. It's like it's important. Like that's a human thing. Again, that's a human behavior thing. If you're seeing patterns of a certain way that reminds you of something, even if it may not be the case, that defense will come up automatically. That's kind of muscle memory, and that's not a moral failure, and that's not an attack on anyone's part. It's not a failure on anyone's part. It's just something important to be aware of. And I think there is a distinct difference between don't make assumptions about anything and then keep it while still keeping your guard. Of course, you can be cognizant of other people. You can be cognizant without being open-minded. Essentially, you can be cognizant and aware while also being like caring and internalizing everything. There is a sieve that comes through it, but it's also kind of bending in a way, and that's kind of I think that's an important way to have these conversations. Questions. Yeah, Kimmy's right. Questions help prevent assumptions.
Yeah, questions help prevent assumptions, but up to a point, because it also depends on if the person answers those questions honestly or not.
Exactly.
because at the end of the day, right? Like we can't have a discussion about civic engagement in the mental health system without understanding that the two movements are separate because of ableism within the general disability community. And until we unify and get away from like the diagnosis, if you're diagnosed with a disability, that should be safe for your doctor, not for movement work.
Yes.
And that's been the issue why the movements have been separated, because we have allowed the diagnosis of mental illness, even though the institutionalization process is the same, right? Like people
the pathologization of it
is the same, right? Especially back in the day, right? Like back, and I'm talking about more so back in the day than now.
60s, where they did all the protesting and marches, and they did the work.
And how they would just weaponize disability and all of that. I met people like that who were doing that work, and they did not let it didn't phase them. They were like, yeah, I was misdiagnosed. They said I had schizophrenia, or they said I had bipolar. Yeah, they were wrong. And yeah, now I'm an ex mental health patient. I'm a psychiatric survivor, right? And so those are the people I was around, and they were like take no prisoners.
Exactly. Yeah. But I think there's a problem, like being a psychiatric survivor. I don't use that phrase at all. I honestly, with me, like I will acknowledge that I am a survivor of medical abuse, because psychiatry is a field of medicine. And if mental health is so heavily pathologized, and there is either harmful practices or individuals who still practice like harmful behaviors or harmful practices who are still working it, it is no longer as widespread and standard practice as it once was. You're right. It was a lot worse back in the day, because there was no protections behind it. But the fact that the protections are still having to be fought for and still having to be enforced, and even then it's an uphill battle, means the practices of before are still happening to today, even if there is a lot more pushback and friction in order to not let it be so free reign as it once was. And I think that's honestly where a lot of the, again, same conflict that comes into it, because it's not a dismissal of the history. It's not a dismissal of the damage of it all, of the damage of the practice those practices cause, but it's also an acknowledgement that a lot of those practices are still happening, even if there is a lot of friction blocking away, making it a lot harder to get away with.
I don't think that the practices are are happening in the same way.
Not the same way, yeah.
And I don't see them happening in the same way. And first of all, they don't even keep you in the hospital as long as they used to.
Yeah, because insurance won't cover it anymore.
It's not just that. It's also it's even if you have state insurance like Medicaid or whatever, it's the legal aspect of the Supreme Court case, Olmstead in the 90s, that said you need to be in the least restrictive environment possible. So a lot of that has to do with that as well. Like
exactly.
I do. So I will say this. This is where I land on this. In order to have civic engagement, right, and in mental health, and I get you don't like the term psychiatric survivor, but not everybody engages in the other parts of the mental health system. And I like to call, that's a specific type of mental, that's a specific type of abuse. And I like to call it what it actually is.
Yeah, it's
that's, like you say you don't use the term, but I'm using the term psychiatric survivor. That's the term that's in the movement. They, in the MAD movement, that's also a term for the mental health movement. And I think also it's, to be perfectly honest, like it's hard to have conversations about this when you have been, like you're still dealing with the backlash. I'm not dealing with the backlash of it, right? Like I'm not having, I when I was younger and I was in the movement, I was a lot more like Tig in terms of like, and now, and that pissed a lot of people off.
Yeah.
Like to be perfectly honest. And I had to learn, like, okay, well, do I want progress, or do I want to be, I don't want to say right, because right isn't the word.
Yes, it's like, do I want to make things better, or do you want to be right?
No, it's not right, but it's, do I want to hold on to my trauma?
Right. Yeah. Correct.
It's a level of like righteousness, essentially. It's not really like being right in terms of correct, but like being like righteousness.
No, yeah. It's not a righteousness. It's like, I want to hold on to my pain, my trauma. Right. Like, because I can be righteous about things and there's not necessarily trauma attached to that. But for me, I was holding on to my pain and doing the work, versus now where I have to deal with like Medicaid tomorrow around certain things and how annoying it is. And I'm like, okay, that's my personal, but then I got interviews that I got to do tomorrow. I have 2 interviews I got to do tomorrow. And I'm like, I got to like show up in a different way. And I think that's why the peer support movement got corporatized and moved away from that model of like, they started taking the civic engagement out because there were too many people who couldn't remove their trauma responses. Yeah. And I'm not saying that trauma response, I'm not.
No, I'm with you on it. It's like there is a level of like shielding, like, oh, I can't do this because of this happened, or this trauma, or this response that I have, even though you still can just push through it, essentially. It's like you can still do what you got to do. And I think I think you're right, honestly, to notice that with my generation, there is a lot of learned helplessness. And that's something I had to fight against a lot, because 4 years of homelessness, trying to get out of that because I refused. And I think there is a lot of you're right. There's a lot of learned helplessness with it. And specifically with my generation as well.
Those are your words, not mine.
I know, yeah.
I did not say your generation. I think there's learned helplessness. There's a lot of learned helplessness in general disability community and in the mental health community, because of how people are just, live in their diagnosis and not in their what they can do. And I just want to be clear, when I say no, take no prisoners, don't be a victim, I'm not saying that if you have limitations that you need to push through that.
Yeah, of course not.
Be clear there. But
It's like, do what you can.
Yeah, it's do what you can. I just want to answer a question. Somebody has a question. How do we get over the anger?
Mhm.
And so Tig and I are both, Tig and I are both people of color in the United States. So and so and Tig is also first generation born in the United States. His parents are immigrants. So
Yeah,
so
combined with, oh my God.
there's so I'm gonna have a different answer for Tig for people than Tig might have. So my answer is well, that person, you can be angry and like, is that person even thinking about you, or is that situation thinking, or like is it?
Even if you win, you're still feeling the anger after the math.
It's
You
not
you
just
can win and still feel it, and that's something you need to live with.
No, it's
Well,
not. Yeah.
and two, I think setting boundaries is very important. What brought my diagnosis about, and I'm just going to put a story out there real quick. I was in a contentious divorce. I have an adopted daughter. I had to sell the marital home. This was like 2 years ago. And I had to move in with my adopted daughter's biological family. Well, that didn't go out too well. And I had a lot of triggers there. And there was a lot of bumping heads. And that person asked me to move out. So I did. And then I was diagnosed bipolar because I'm just like this, like my brain, I could not control my emotions. And I reached out to a psychiatrist. I'm like, I need help, and so I got properly diagnosed, properly medicated. I feel great now. Well, that person reached out to me the other day and was like, oh, I miss you. Can we just put the angst aside and be friends? And I'm like, I'm not ready. You need to stay over there because
Yeah.
you're a big, huge trigger to me right now. Like you caused me a lot of PTSD and trauma, and I'm choosing not to allow that into my world right now because I'm in a good place.
Yeah.
Exactly.
So, can I ask a question of you?
Sure.
So, what do you want to do, like moving forward, right? Like, because I think it's not about in terms of like how can we do this in a better way, because I do think there's acknowledgement of how we handle trauma through
Mhm.
not only our lived experiences and based on how we grew up and stuff like that, and generationally how we handle things, but I also think, like, my question for you is if you were to blow up tomorrow with this
Mhm.
platform, right, that is great to have
Mhm.
these discussions, would you be willing to fold it into more of the general disability movement, or do you think you would want to stay siloed?
Oh no, I mean, I would love to, get on different platforms but the thing is this has only been on since December. And the reason why I started it was, I felt like I needed a place personally. I needed a place to have open conversations with other people about their disabilities, their mental health, and just to get deeper understanding for personally myself. I went my whole life having these behaviors and didn't know why, and now I don't want to say validation because it's not validating my behaviors, but an understanding as to why. Right. And so when I started this, that was basically it was for me personally, but I think there's more and more people like getting involved in it in the chats. It's been great. We have different topics every week. We don't just stick to, one topic, and the thing is I allow, like at the beginning, I would come up with the topics and I would reach out to certain people that I thought would be a good guest for that topic. Well, it got to the point where it was better for me to reach out to guests and be like, hey, this is what I do. Would you be interested in being a guest? And if so, what would your topic be? So I'm hoping this goes somewhere. And yeah, I would love to, take it further. That I'm streaming on multiple platforms. I'm hoping to get more viewerships. I'm hoping that people would reach out to me and be like, hey, what you're doing is great. Can I come on your show? You know what I mean? So I hope that answered your question, but
it does, because I know for me, in order to talk about civic engagement, we can't, how do I say this? We can't just stay in our silos anymore. Like
Sure.
for me, it's also I've had to, what a lot of people don't know about me is, and there's this, it's not even an assumption, it's something I just keep to myself a lot, is I have to protect my own sanity. And a lot of times I don't think it's just about being human, that you're protecting your own sanity. I've been on, I'm closer to 50 than I am 40. And so I've seen a lot of the same stuff like that Tig is upset about. And I'm like, this is not, none of this is brand new. And I think we need to stop acting like it's brand new. I think we need
really
to
not.
And we need to stop acting like it's brand new, like everything that we're experiencing. It's not. This like the empire isn't falling apart. This country's always been this way. People are saying it's falling apart because they're not.
The people responsible just can't be bothered to market themselves properly anymore.
Yeah, that's pretty much it. And so we have to be willing to take responsibility for ourselves. We have to invest in ourselves as in our community. And that also means, last thing I will say is that it also means that really knowing history and not letting it cloud your judgment, right? Like not letting your personal, what happened to you personally, cloud your judgment. Because I'm saying from my own personal experience with when I was doing LGBTQ stuff and I've dealt with homophobia and on the outside, and that's why I got involved in the movement. And I had to people that don't want to, even people who are doing the work don't want to hear it, right? And so people, it's not that they don't care, but they're like, well, how does that help with the work? That might help when you're talking to a member of Congress, or your state legislators, right? But it doesn't help when you're in an advocacy space. People don't want to hear it. You scare people away when you do that. And so that's why I'm like, okay, I'm just started, I put Alex's book down because I'm like, I can't read this right now because I'm having a lot of, triggers from it. And I can't, if I can't read something without without affecting my judgment, then I don't do it.
Sure.
And that's how I operate in the work I do.
Sure. Yeah. And, I like I said, we have our disclaimers. We're not professionals, we're just providing a safe space for anyone who would like to just talk about, anything. But I am also, I just turned 55 in January, and I've been a 25-year state employee with Utah Schools for the Deaf and the Blind. So, I've been around several types of disabilities as well. I have a deeper understanding about it than I might portray when I come on here, just from my own personal experience. But, for me, like I said, getting involved locally is definitely what you need to do. If you want to make change, you need to speak your voice.
Yeah,
And
I say this all the time. One of the things I've been really like traumatized by is, and Joe has a question. I'll answer that. Is the main race, like everybody's complaining about the main race,
Mhm,
and I'm like, I don't live in Maine, but I do live in New England, right? And
mhm,
I'm like,
Yeah.
none of you live here,
right.
right? Like if you don't live in the 6 New England states, I and especially, I mean, and I'm counting Connecticut because it's technically part of New England, but
Mhm.
unless you live out, if you
down for the night and chill.
Sorry, that would be my alarm. Sorry about that. Continue.
oh, okay, and I don't want to hear it. I don't want to hear it, and I have to deal with every single day when I have to interact with male mediocre guys
Mhm,
generally, but usually they're white, but it's not always white. And when you point out the fact that, yo, you don't live here, you don't live in
mhm.
the region, you're not, you say, listen, and even white women, no offense, Sushi, but I've
Yeah,
also had that experience with white women as well.
sure.
Black men in general, but white women, the subset as well, will say, and it's usually on the progressive side, listen to black and brown women
Mhm,
specifically. That's usually the statement that they make. And it's like, when you point out, hey, you don't live here, maybe you need to listen to the people who are actually living here, who are actually reporting on the race, and not national mainstream media,
mhm,
or even people who just live in the region, who know how interconnected the region is. That messed up my mental health. I got into this back and forth with someone who I literally said, I'm going to wait until primary's over. If he wins, I'm going to try to interview him.
mhm.
And people were saying, hey, the person who I was going back and forth with, saying, hey, got it. If you get access, you're not going to hold him accountable. I'm like, I run a disability organization. So like all of these things around his tattoos and how
All of
he,
it. It's
well, it's none of my business.
Mhm.
Right? It's not my business. Like, because if I went down that rabbit hole, I would never get any work done.
yeah.
Yeah.
I would never get any work done. And I'm not even going to say this isn't in a marriage, but we have someone in Maine who's the senator in Maine who, when ICE came to Maine, instead of like standing 10 toes down and saying, you need to leave the region, you need to leave the state, but you also need to leave the region, she
Mhm.
negotiated a deal and they decided to come to Massachusetts instead.
Mm.
So she's so that's the reason why when people live in like Colorado or Texas or anywhere that is not anywhere near New England states, I don't want to hear it. Right?
Mhm.
And that's the trauma I've been dealing with, right? Like, and I've had to, like, you know what? I'm not going to engage. I'm going to
Mhm.
say it once and that's it. And it sucks because I
Yeah.
know if I engage with it, I will have like that same like reaction of this, like the reaction that Tig and I had earlier. We'll
Mhm.
just say like you're, and I
Friction.
don't, it's not just friction. No, it's like I could get to the point that I could just go scorch earth and not care about your feelings.
Mhm.
And
Wow.
yeah,
Yeah.
yeah, and that's why, like, yeah, and that's why I have to, the community engagement in the work is important, and it's not, over the work that I do is over, it's the community engagement work, and that's from Joe. How you overcome the paralysis caused by PTSD. It's
Yeah, of course.
I don't know if Tig, what's your thoughts on that question? Is that why
The
you wanted to?
paralysis. So my thing is that I don't really experience paralysis in that way. It's weird. Because like I think like the main like the why people why this is my assumption because it's not been my experience, but my like base thought when I decide I want to get involved in a community. I want to come up with a solution, even if I don't know what it is at that moment. I'll figure it out somehow. Is not that I can't do something. It's this base thought is, why not? You just never really assume that you can't. You never assume that you can't do something. And even if it doesn't work, you could still try a different way. You just never assume that you can't do something. Or you never assume that you are either not enough or not worth it or not going to succeed. You never assume premeditated end all failure, because even if it doesn't work out, even there's a mistake, even if there's a failure there, that's never an end all. You just never assume you can't do anything.
Well, I would say for me, to answer that question, I was never diagnosed with PTSD, so I can't. I just,
Yeah.
I was not diagnosed with PTSD. Anxiety, caused by neurological stuff, yes, but that's not PTSD.
Yeah.
And so I would say I've always was the go hard or go home type of person from like childhood, because of how my mom grew up, and she was like, she passed on the no, like obviously within limits. Like my mom was very clear, like there's certain things I can't do. Right? She's very clear on that. But she also is like, there are things you can do, you just don't want to. And that's the reason why I'm like, have always been like, unless something is going to, unless you have a plan, right? Like it's like when I started Disability Community for Democracy, I didn't tell anybody anything until I actually had the plan laid out of the framework of what I wanted to do. I didn't say, well, it sucks and we need to do something. It's like,
of course.
Yeah, that's where I get frustrated. And that's why there's no civic. That's why I think the civic engagement is needed. And
yeah, exactly. I mean, honestly, that's why I get frustrated too. Because even in the events that I have a plan for, even if it's not like disability or mental health organized, because I'm not as experienced in those systems and working on that front. I'm experienced as the receiving end, but not as well as the suffering end, but not so much on the working end of it. And that's something I'm really trying to like work more on and learn more about in the future, not just from the history, but also in the logistics perspective. That's why why I'm working towards a career in actuarial consulting, because that's all logistics, basically just Sherlock Holmes logistics, essentially. But I think that there is it's not just enough to admit something is shit. It's not just enough to make to say something this isn't working, unless you're like, okay, if this isn't working, then we find a way to fix it. If we can't fix it, let's salvage it and come up with something better.
But not everybody. You also got to take into consideration, and I think that's why I'm like, unless you have a clear like third, fourth, fifth way.
Exactly.
Let me finish my point. It's not about. Sometimes you just need to say it's not working. Like I think the first, it's kind of sort of like if you're in Alcoholics Anonymous or any 12-step program, the first step is that we admit that we have a problem and that our lives are unmanageable. If we can't just do the first step, then nothing works. And I think that's really the issue, where everybody's like, well, we need to do something about it. It's like, okay, well, we have to admit that there's a problem, and we need data to admit that's a problem, because I might not see some of the things that happen to, some of the experiences that happen to Tig for it to be enough. And Tig, this is not just, I'm not trying to minimize your experience, but there might be people who say, well, I'm sorry that happened to you. I'm sorry that happened to so and so, but there's more data, right, that says we need to keep it the way it is, because if we don't, it's actually going to cause more harm. Yeah, and as somebody who didn't get diagnosed properly until, in certain aspects, until I was closer to 30 around some of the things. That's also harmful. And Tig, I would love, I would love you. I would love for you to talk to millennials and younger Gen Xers who got diagnosed with autism, not at 17, but 35 to 50. Right. And the
Yeah,
whole that they went through, because as much as I'm not trying to dismiss what you went through, but I have had friends of mine who didn't get diagnosed until that age, and they have they had also mental health issues, but they didn't get the autism diagnosis or the ADHD diagnosis, and now their life is worse.
yeah. I remember that phase.
Yeah, but
that was like going into my early 20s.
yeah,
But
you
even
were much
and
younger
you're right, honestly. It's like I think it's also like the data behind it is that if only I really wish my case was an outlier. Unfortunately, it's not. And I think you're right. Like we need to acknowledge that this isn't working and it's not. And I really wish that that my case was just a one-time thing. I really wish that my case was just a bad experience in that way, but unfortunately it's not. And there is a pattern here. And it really has to go into the question of like, yeah, is this the best we're going to get? We just keep things the same and not change anything? Or is there enough harm that is happening here and the data behind it that shows it that something needs to be changed? It doesn't mean scrap the whole thing and start over. It means something needs to be changed. We need to build off the scaffold that was fought for historically, because it may not be as substantial as it once was. It's not. It's like, oh, like it's kind of like, oh, but Obama was president, everything's fixed now. It's not. and it wasn't. Like even then there was a lot of issues and a lot of different ways that those systems can be weaponized. And I think that being able to acknowledge that is important, that even though it's slightly safer, it's not always 100%. And being able to acknowledge,
but
yeah, exactly, nothing is 100%.
Nothing's going to be ever 100%. But there's more data that on from my perspective, on my side of people who are closer to me in age, who have been harmed, more like Sushi and myself, and there's more data in that direction versus the direction that Tig is in. And I'm not saying that Tig, I want to be clear. I want to be clear. Like I want everybody to understand why I'm saying this, because there's a whole generation, especially women, who are premenopausal or menopausal, who were taught to hold it together and all of that. And the only reason why I got diagnosed as much as I did was because one, my mother was in the system and knew how the system worked, and two, I presented more like boys. So I had more of the hyperactivity, and this was the 80s. And so when girls present that way, it's like, oh, no, right? Like I didn't talk until I was a late talker. I had all of these delays. And I think that's what people don't understand, right? Like I got, in certain ways, I don't want to say blessed, right?
Yeah.
Because I don't like, I don't want to, but it was luck of the draw that the things that I had to deal with were more like boys.
A little bit more textbook.
Yeah.
A little bit more in line with textbook. And I think that's something that needs to be acknowledged as well.
Yeah, absolutely. And, I hate to cut the conversation.
I know,
it's our half hour over.
Oh, yeah.
It's been great, though. Naida, thank you so much for coming on and sharing your expertise and what you are working on. You want to sell yourself again real quick for the audience? And
yeah, sure. I'm a little tired.
Yeah.
So I'm Naida Green. I'm the CEO and founder of Disability Community for Democracy. We are on Substack as Disability Community. We have a publication called Nothing About Us Without Us. If you become a paid subscriber to Nothing About Us Without Us, because we are 100% volunteer organization, it pays for all of our expenses that we have, we have a live stream program that we do twice a month called Tell You No Lie on usually on the second and fourth Friday of the month. We have a audio series called Disability Conversations, and there's a lot of ways you can get involved. Tig, Tig is one of the contributors. Tig is contributing in the second half of the year, and Tig, you got to tell me what your pronouns are because I don't know what they are.
My pronouns are they, them, but I take the form of whatever suits my needs. I can be king and queen, best of both things.
So that's what I would say. If you want to learn more how to get involved, follow Disability Community on Substack. You can follow me personally if you want to follow me personally. It's just my first name, last name, Naita Green. But if you want to learn more about Disability Community for Democracy, follow that page. Don't follow me only because I don't post everything for Disability Community for Democracy on my page. This is my personal. So
yeah.
I hope that helped.
Yes. Thank you so much again. I know you're tired, Naida. We tend to, like, when I end a live stream, we just kind of sit backstage and have a debrief, but you are welcome to leave.
No, I can stay. Stay. I'm fine.
Okay. So I'll go ahead and end the stream. Thank you, everyone in the chat.
Thank you.
We'll see you next Sunday.
Thanks.
See you next week.
Mm-hmm.